sex therapist, sex counselor, and she's focusing mainly on surrogate part of therapy, practice in Boston. So it's lucky we have her here. During the India visit, we used to call her. Thank you for coming all the way. Anita, the place always. Thank you.
Thanks, Natesh. And while I am going to do a small little exercise with everybody in the audience, Natesh, could you please help me put these models here? So I know it's been a long day. You all are tired and probably not even to our body right now. So for 5 minutes, I'm going to do a small exercise. Can I have everybody stand? Everybody. Ooh, I know. Knees, hands, legs, ankles. Wonderful, wonderful. So we're going to clap 5 times. 1, 2, 3, 4, and 5. This is awakening your hands. Shake our body, hands, legs, head, everywhere. Feel your body, friends. Feel your body. Lastly, pat your body. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3. So, nice. So what I have done is demonstrated a very, very powerful exercise which we do with patients who've gone through trauma, people who do not feel their body, have desire issues, or sometimes just want to get your body to yourself. So after a long day, after a tiring day, when we just don't want to talk to anybody, we don't have that energy in our body, we want to start feeling this body one more time. So this is an exercise to awaken your hands, connect with your body, know your body, create the boundaries of your body. Sit down and let's learn. So sexual surrogacy or hands heal the unspoken and unseen. And of course, our hands are very powerful. Lot of research has been proven that you can demonstrate your entire body in this hand. And the healing power of hands is tremendous. No disclaimers. And thanks Natesh for having me. We've been in touch since last year. He believes in this topic. He believes in this form of treatment for patients with sexual dysfunction or just patients who are suffering from intimacy or relationship issues. This is my mentor, my teacher, Dr. Susan K., who has been a surrogate partner and also she's a supervisor. She lives in Austin and she says hello to all of you. This is me, a small introduction about myself, and this is going to be the entire content of what we talk. So what is surrogate partner therapy, or also we can say client partner therapy? It's a professional 3-way therapeutic approach between a licensed therapist, a client, and a surrogate partner. Now this helps a person feel more comfortable with intimacy, sexuality, sensuality, and their body. It helps to harmonize interpersonal relationships. Now the surrogate or the surrogate partner engages in structured and unstructured but very experiential techniques with the patient, and they're always in touch with the therapist or the physician. This is called the triadic model. This was founded by Master and Johnson's, where they thought they would get involved a licensed therapist who will take the history, who are neck practitioners, take the history, do the talk therapy, but they want to work with surrogates who use their hands, who use somatic work, and they help these clients. So this is a triadic model, and thanks to Dr. Susan K., Dr. Susan K. has expanded the triadic model for medical practitioners. So instead of just a therapist, a psychologist, now we have medical practitioners like urologists, like we have gynecologists who can just take certain history, don't have much time to spend, but then they hire or they work with a surrogate partner to help patients. Now these patients can be individuals who are having issues with their body, sexual dysfunction, or these are couples. And surrogate partner is not something which is new and hoo-ha. Surrogate partner therapy is coming to us right from ancient, from Kama Sutra days, and also during World War I and II. Now, I remember watching this program, which is Aisa Bhi Hota Hai ya Khoj India, and one of our tribals in Northeast. So it was a tradition followed that there would be one lady for the entire lineage of people, and she would be the person educating individuals. So as when the teenager boy or the girl would hit puberty, this lady was in charge of educating them, giving them sex education. Also, people aware of Chhattisgarh? There is a tribe still there in Bastar, city of Bastar, and they have something called as a Gurukul or Guntul, where teenagers and adolescents go there for sex education. Very interesting. So surrogate partner, client partner has not been something Wuhan knew. It has been going on since ancient time. But we have our dear Master and Johnsons. What happened to this? Dear Master and Johnsons, who officially they studied with 105 male patients who had sexual dysfunction, and they paired them with a surrogate partner, and they said, wow, this treatment works very good. This form of therapy, partnering a male having sexual dysfunction with a surrogate, was showing beneficial results, and they are now called the founders of SPT. This is Master and Johnson's who introduced and formalized SPT. So these are some books if you want to read. So what is surrogate partner therapy and what is this approach about? Like any other therapy, a surrogate takes a detailed history. The physician and the surrogate are always working together, and the goal is to help this client. There's a lot of interview sessions where the trust building is formed, which takes around 3 to 4 sessions, and then they start working towards what is the mutual goal for this patient. And of course, later on in the third stage, if there are general exploration or understanding the body required, that comes stage. But this is a very, very professional, scientifically proven approach where a surrogate works with a patient in collaboration with a therapist or the physician. So this is kind of like a stage which says the trust building begins first. First, there is an acceptance. There is trust, acceptance, and permission that this individual wants to help, wants to take help from this surrogate. And then beyond that works different areas. Whatever the problem is, why is this patient coming to the therapist and to the physician, and the goal is created. So who needs a client partner therapy, or who needs a surrogate? Right? So anybody, whether it's an individual or it's a couple who are suffering from maybe desire issues, maybe arousal issues, maybe some orgasm issues, or maybe pain issues, and it is with all diversities. So this form of treatment or this form of support is not just for one gender. So as I said, any of the problems with the sexual dysfunction. What are the other areas a client partner can really be assessed? So we have people who have fear or avoidance of sex, have intimacy issues, lack of a lot of relationship problems. Also, very commonly, a surrogate partner works with individuals having body image issues, negative body image issues, all the negative, like Dr. Nilima was just talking about, all the negative upbringings, all the negative messages, social media, everything which is causing problem in her intimacy or in individual's person causing sexual dysfunction. So this therapy can be used. So even patients with lack of social or sexual self-confidence, the partners or the surrogate or the client partner therapy can be used. So what is the role? What is the role of a surrogate? How can this addition to your clinical practice help you? Right? So you see these are various models which I have demonstrated there. I wish this table was closer. But what a surrogate does is a surrogate can be somebody they practice certain techniques. A surrogate can be somebody who educates this couple or this individual, or somebody who rehearses, who does role play of relationship skills during the session. What different this surrogate does is gives feedback, because the goal is to help this patient. So the surrogate gives feedback to the patient of how did the session go. The feedback is also given to the clinician or to the psychologist, knowing what is the progress, how is the progress of this treatment happening. For people who have who have learning issues, other form of behavioral issues, these tasks or these exercises or therapies are broken down into small pieces till the patient or the couple is able to understand and take it forward. Now, this was a nice movie, The Sessions, and this movie by Ben Levin says surrogate also helps in giving expression to the sexual needs and desire of individuals with disabilities and impairment. Let me bring some some movie. If you remember this movie, Blind or Black, where Rani Mukherjee and Amitabh Bachchan were starring this movie, and Rani Mukherjee did not experience a kiss, and she tells her teacher, "I want to experience kiss." Well, that can be helpful. That is where a surrogate can be helpful. When somebody who has not experienced because of not being disabled but not having the ability to experience that. So a surrogate or also called as a client can be partnered with somebody who's a professional person who can help this individual or the couple to experience. Now, what are the myths around surrogate partner therapy? They say this could be a trap and there would be a lot of nudity involved. Body exposure, of course not. There are no clinical benefits. I have just proven to you that the triadic model involves a physician, involves a therapist, a psychologist, a therapist who works with a surrogate to help the client. It's a glorified prostitution. No, of course not. It is a way for men to force themselves on women? Of course not. It's a myth. An easy way to get money from rich clients? Of course not. A mean to fulfill sexual fetish and desires? And of course not. As I said, it's a very, very professional three-way relationship, which is surrogate partner therapy. Now, people always say, so what's the difference between commercial sex workers and prostitution, right? So sex workers or commercial workers will not be educators. Their goal, and you can go around reading this whole thing, but what a commercial prostitute or a sex worker does, they want only financial gain. Whereas a surrogate partner doesn't need financial gain. She or he are only working towards a treatment model, treatment goal. So a sex worker or a prostitute basically work around satisfying their patient. A surrogate therapist doesn't work around satisfying the patient. She works around experiencing, giving them the experience, giving them the education. So sex surrogate or prostitution is all about demand of the client, whereas surrogacy is not about demand of the client but demand of the problem. Prostitution is unregulated and illegal. Certain countries have legalized surrogate partner therapy, especially countries like Israel, countries where there were World War II and III, and they brought surrogate partner to help the soldiers who were suffering from trauma. Or so if the soldiers were away from their family for a very long time, that distance, emotional distance created, surrogate were brought into picture to help these people for a therapeutic goal. Now, this was a nice research done in 2013, and of course, when we talk about surrogacy, people are here to jump and ask me, so are these people who are going to be a partner or a replacement to a sex partner? And of course not. Statistics shows that 32.10% is touch-related activities. I just demonstrated one activity to you where I didn't have to touch you, but still you could feel your body, you could create that boundary and come inside yourself, feel this body. 32% was touch. 17.69% of the surrogate partner therapy works is about reassuring, support, validating that there is a problem, but there is some support and help given to you, available for you. A few more minutes. 16% is providing information. Anatomy, sexual response cycle, all that information, knowledge given to the patient, which the patient hasn't received before. Non-sexual experiential activities. I just demonstrated one. various other sex therapy activities where again no nudity involved, no touching involved, but we use these kind of models. They also can be sex coach. So sex coach also, surrogate partner can work as a sex coach where individuals who've not dated before, they don't know how to talk to a girl, they don't know how to talk to a boy. They actually help these patients to give voice to their feeling. They help them go on dating site. They help them give vocabulary to how they can approach a man or a woman. So all this education revolves around a surrogate. A surrogate can be that support. This is our friend Dr. Ronit, and she has made a clinic where she has surrogate partners, and the treatment is given. Initially, was started for soldiers, for veterans, but now it has been open to people who have sexual or intimacy issues. This was a nice movie. Please feel free. It might be available, an award-winning movie which talks about Ronit's work. Present day, and we just talked about what is the difference between prostitution and a surrogate partner. So at present, what surrogates do, they are well-trained professional, they improve relationship skills, reach the therapeutic goals, and they are open-ended. So what are the parallels? So who are these people who can get these trainings? Trust me, friends, I have friends or colleagues who are psychiatrists, who are various neurologists, who are trained in this field, but we have body coaches, we have sex coaches, we have pelvic flow therapists, we have systemic desensitization exposure therapists, social skill or even life coaches can get this training and help people. Training is available to IPSA, which is an International Professional Surrogate Association that includes SAR also, lots of sensate focus exercises, workshop, information, education, and training about various sexual dysfunction, which no other people get. If you talk about psychologists and other forms of therapists, they do not have such intensive and extensive learning. This is the training provided by IPSA. There are various ethical codes which are strictly followed, monitored by the supervisors. And very, very different than talk therapy. As I just told you, talk therapy is all neck up. You talk. You can give multiple advices about vaginismus, erectile dysfunction. But here is going to be a professional who will actually sit there, teach you, guide you, be with your partner and help you to actually navigate what we can do for this problem. So it's not talk therapy, it's more of experiential and demonstrative therapy. Lastly, what does a surrogate do to you? A surrogate gives voice to a person's feelings, sexual feeling, individual emotional feeling, and empowers this individual to look into themselves. As I said, and I demonstrated one thing, if one cannot love themselves, one cannot hug themselves regularly, you cannot give that love to somebody else. So that's what a surrogate does. That's what a client partners with this individual or this couple and gives them the voice to love their body first with the help of various exercises so they can give the same love and share the love with the couple. These are various books. Future, I hope we bring this form of therapy to all the clinical practices where if Natesh is busy with his clinical practice, he has a surrogate who can help his patient, still benefiting the patient, achieving a nice practice and achieving a therapeutic goal for the patient. And these are various reading modules, reading suggestions. Please go through them. And thanks to Dr. Susan K for making this presentation with me and giving me that liberty to come and present this in India. And I've talked to Nitesh for 5 more minutes where I'm going to demonstrate another exercise for you all. So these are exercises when you go back home and you are seeing your patient. These are certain experiential, sensate, focus or touch-based exercises which you can directly give it to your patient and you can see the results when they come back. Natesh, come on up. 5 minutes?
You're putting me in a
Of
tough
course
situation.
not.
My
Of
wife
course
is
not. So this is one exercise.
She's saying it. Let me see
So-
what's going on.
So this is one beautiful exercise. Beautiful exercise when somebody is suffering from desire issues or Somebody comes and says, my partner doesn't love me enough, he doesn't know how to love me, or she doesn't know how to love me. Well, I'm going to teach Natesh a wonderful exercise where he's going to first fall in love with himself. And then he is going to share this love with his partner. Come on, Natesh.
See, this is not in the script, okay? So, she'll go until she'll ask me, why are you putting me this trouble for asking this kid?
So, Natesh, let's put that mic down. Five minutes.
Yeah, sure.
Okay.
Come on, Natesh. You can do it.
So, Natesh.
Let's do everything you want.
So, Natesh, just stand straight. You're opening your arms in a receiving position. Take deep breathing 3 times. Let's go deep. Inhale. Exhale. One more time. Deep inhalation and exhale. Lastly, deep inhalation and exhale. While you are closing your eyes, Natesh, take your palms and rub around your shoulder as if you're hugging yourself. So, Natesh, hug yourself. This is your body and you love yourself. While you're rubbing yourself, while you're hugging yourself, go deep in your touch. Deep. So, Natesh, this is your body, your beautiful body. Massage your body. Get that feeling of, oh my God, this is my body, this is beautiful body. Touch yourself, hug yourself, massage slowly. Continue your deep breath. Wow. So Natesh, this is your wonderful God-gifted body and you love it. This is all about experiencing the feeling. With each rub, you can experience your body in a much dignified, in a much delicate way. Love yourself, love yourself, love yourself. So this is a nice exercise, friends. If you are dealing with couples, if you are dealing with people who have relationship issues, please advise this exercise to them. The more they love themselves. So this was a big, nice research done, Natesh, where this researcher advised their patient to hug each other 5 times a day. And then they took a blood sample and looked upon how the cortisol level was, and they saw that the stresses had gone down. And that happens even with small kids. Also, there was another exercise done with kiss. Whether you kiss on the forehead, whether you kiss on your cheeks. They saw these individuals and couples for weeks and months, and they found the more these affectionate feelings, the more affectionate touch, showing love was done, the stress level went down, the diabetes went down, their blood pressure started falling down. So please go back, share this with your friends, share this with your clients, and I hope to see you next time. Thank you. These are certain models we have. We have the vulva with the clitoris for sex education. We have this wonderful talking puppet, which is a talking vulva designed by one of my very good friends. So this is all used for education, and also if somebody is suffering from intimacy issues, sexual dysfunction, these are very nice being used. It really helps those people, gives them voice and gives them that liberty. Yes, I can touch this part of my partner. Look at this. Hold on, Natesh. Look at this. Look at this. You have, how beautiful can this be? Non-threatening, non-demanding. If somebody is suffering from pain, penetrative issues, give this, and we do certain exercises where they have given the liberty of touching it, feeling it. This is what a surrogate partner can do. They can be an educator, a coach, a guide, or just a friend. Thank you.
Rakesh, how does it feel?
This is going to open music clinic next year. We'll come and inaugurate it.
So there was one comparison, he practices hug therapy. Kadipudi Vaidyan. So that is all that one of my previous remix in Tamil. So you had something, then I'll.
Thank you for the wonderful insight. I know we've not touched upon it in psychiatry in India or in Asia. It has a lot of cultural issues as well. I see when I look at the American part of it, a lot of CBT work happens, but then we have sort of become more reductionistic in my opinion, because we keep going to emotionally focused and we've taken little theories, but I see the CBT part in it, and I also have a suggestion, a surrogate, and now in the world of AIs, I think we should go forward with it, and maybe AIs will be able to help because touch therapy seems to be very off mode in India. Just minimal touch even is something, they say, please take off, don't do it. So I think it's a very difficult scenario. Hopefully we'll be able to cross those boundaries and help clients from various backgrounds. Thank you. I open the floor for any questions.
I truly understand where you're coming from, because touch is becoming a big problem even in the Western countries because of all the legalities. But here, you are not touching your patient. You are guiding this patient to touch, guiding them and demonstrating them. Your touch is not happening. Right? So imagine a patient who has trauma, being raped, sexually assaulted. If this patient comes to you with after so many years of having intimacy issues, problems in their relationship, you're not going to touch that patient because that patient will not allow you. But what you are going to do is, you are going to be that vessel, that encouraging vessel who tells her that, hey, you know what, I understand your problem. I'm not going to touch you, but I'm going to help you to touch yourself. You touch yourself. You calm yourself. You connect with yourself. And when you connect with your partner. So you will not touch, I will not touch. This is what I just did with Ritesh. So thanks for that lovely question. Anybody else?
I just want to add one thing from my side. Subhashini, she referred a patient, unmarried guy, who came with his mother, that he is not able to have a pleasurable orgasm by masturbation. So after multiple things, then I believe he can be one of the options for surrogate partner therapy. So then I spoke to her. We fixed something. It was so much trouble for him to tell his mother, because she is going to decide a paying cost. Ultimately we told, but nothing happened. So again, the cultural thing is there, how to put forward, because as she asked, you answer now. If the patient mother or the patient themselves, they think somebody is going to touch me. So it's a subtle again. We like to, these are not the treatment modalities. It's up to us to fit this where it's warranted.
I love that. Fit it to your practice.
Yes, that is what.
In a more ethical and dignified way, but fit it to your practice.
Yes. So
you
we
don't
are
want to follow US, you don't want to follow any other country. This is available. Encourage some of your staff people to learn and fit it to your practice.
But
Yes.
I believe, I feel that there is a high probability of the patients getting emotionally involved or attached to the surrogate partners. What do you think?
Wonderful question, and that's called transparency. So as I said, this is a professional three-way relationship. So whenever Dr. Amit, that happens, when somebody is getting emotionally connected, that's called transparency. If that happens, then they stop the therapy, because that's another condition for closure of the therapy. The person stops the
Who
therapy,
will monitor?
and then there's a regular communication between the physician and the therapist.
But even the therapist might get emotionally involved.
If that happens, because these are all ethical codes. So for example, if I get emotionally connected with you and I'm your therapist, I'm your senior. So if I get connected with you, I know my legalities, I know my ethical boundaries. I'm going to say, no, I cannot work with you. Let me refer you to Nitesh. So these are very ethical issues and one has to work with ethics. Any more questions?
These counselors, do you practice in addition with the psychiatrist and you together or?
Yes. So I practice with a lot of surrogates.
That's your center. The psychiatrist refers you now.
No, she's a.
No. I'm the psychiatrist and I refer my patient to the surrogates.
You said
25 years.
you are in US that you don't practice medicine. So I thought you.
She's a.
So no, sir. I practice my field and then I refer people who are surrogates. I am not a surrogate, but I do. I have people who practice for me. So I keep on referring patients and I do make treatment plans with them. So there is a communication and there is a harmony happening between me and the other practitioners.
25 years back, in my place, a quack is practicing sexual therapy. He hires a commercial sex worker for this purpose. After some time, she approached me to refer the patients. This was happening, and now it was having some problem, and it is she I don't know what happens. So this was 25 years back. There was a sex surrogate therapy.
Wonderful. And see, at that point of time, sir. Yeah. So how can you change this commercial sex worker to somebody who can have a respectful profession, right?
But she helps.
Yes.
She trains.
Yes.
But she helps.
Correct.
Not encouraging sexual.
Correct.
So that is possible.
So-
And before Vayaga area, and this
But I want to tell you something which Dr. Anita sir already spoke about. Nagarvadu and in South India they were known as Devadasis. They were like sexual surrogates. They were doing this sort of a.
There's a twist to the Devdasis. They focused on the pleasure. They were not educators, they were not trainers.
But I'm not comparing both things, but it was something similar to this.
No, see, that's what I'm telling you. That is a boundary. She says very, very specifically. They focus on the pleasure, but this is.
now it is a professional. She trained.
Yes, and look at the
That is
beauty.
different. That is different.
Beauty now, she's respected in that profession and she's not working
Like
for
a
pleasure.
occupational therapist, like a speech therapist.
Correct. Thanks, Dr. Murugan.
See, I would like to give one example. Pythagoras' theorem is
I completely agree with you.
He is assigned to a Greek mathematician, whereas I think Baudhayana or Bhaskacharya talked about Pythagoras' theorem way before him. So and then you ascribe to particular
Before trainees, before a formal trainee, this was happening again to them. Now it is a structure way of saying that. That's it.
So there is a formalization.
That's it.
There is an economic aspect to it.
Is that? Thank you. Thanks a lot.
I think it shows how much we lack awareness about SPT. Thank you, ma'am. Thank you so much for the passion.
I request the chairperson to felicitate you to speak.